So there are all kinds of alternative therapies for people who feel, muscle pain, achiness, and you're here to tell us about one that perhaps people aren't familiar with. What is Delos Therapy?
Yeah, I would say pain and stiffness is one of the most common medical complaints, especially after 35, 40 years old. Most people are feeling a little bit of pain and stiffness.
Did you look up my birthday before you came here?
Well, I know we can help you. So regardless of age, most people at some point in life feel tight.
Yeah.
So the question is, what's causing that and how do you get rid of it? I would say the most common cause is a fibrosis that's happening inside of a muscle, a tightness. You can feel it. The muscles will feel very hard. A muscle should always be very soft. We call that pliable. Right? Muscle tissue is soft in a relaxed state, but it feels hard when you flex it or contract it. But what you'll notice around an area that hurts or feels stiff, whether it's a back, a knee, a neck, the muscle tissue will feel hard all of the time. So if a muscle feels hard all of the time, what does that mean? It means it's chronically tight. It's tight 24 hours a day.
So a lot of people will try stretching, they'll try rolling out muscles
Yep.
using various, apparatus, but
Yep.
that's not enough, you think?
It's definitely not enough. The three most common things I hear all day in my clinic: stretching, foam rolling, deep tissue massages. In my opinion, those three things are not fully effective at breaking up that tightness. That hard tissue, the collagen inside of a muscle, it's very dense. It doesn't move. So when you stretch it, you're actually only pulling apart the pliable tissue, the tissue that's capable of moving, which is typically around the tightness. And it's deeply embedded inside that muscle. So think about it, foam rolling across the top or getting a deep tissue massage across the top, you're not even touching the bottom of that tightness.
So Eric, how do you access it?
We push right through the top layers. So you can actually think of our therapy more of a stretch than a massage. We're actually applying pressure directly into tightness, forcing it to separate. But we're doing it in multiple directions and in multiple angles. The angles and the directions are very important because muscles are three-dimensional, tightness is three-dimensional. So a glide across the top like a foam roller is not a three-dimensional approach. You have to apply pressure in multiple angles and really break up that tightness and restore that uniformity and that pliability to the muscle. We've been talking about pliability for years, but now that Tom Brady is talking about pliability,
now
everyone's
wants to talk
excited.
about it.
Yeah.
Well, where does the technique come from, briefly?
So my father invented it. He's a mechanical engineer, really bright guy that suffered for years with chronic pain, did all of the common physical therapy regimens, protocols, stretch, foam roll, all of that stuff, didn't really find it effective. And having that engineering background and being desperate for relief turned his body into an engineering project and just realized that muscles were responsive to pressure, but they weren't very responsive to other things.
Well, it could be a nice holistic option.
Absolutely.
Do you, though, refer people to their doctors, though, if you think they need it?
Of course. Yeah. I mean, if there's something structural, we always want an image, an MRI, X-ray, CT scan. We collaborate with a lot of physicians in the area. But pain is complicated. It's never just one thing fix all. You have to examine the whole patient.
Lots to talk about. Eric, thank you for joining us.